And the latest and greatest procedure hitting Beverly Hills right now, it's the talk of the town. It's the vampire facelift.
It is the hottest new beauty trend in Hollywood, the vampire facelift.
Cosmetic medicine specialist performs a new procedure nicknamed the vampire facelift, using your own blood to make your face look years younger.
This was called the vampire facelift.
Called the vampire facelift because it uses your own blood to fill wrinkles. It lasts a good long time.
Now a handful of Austin doctors are riding the vampire facelift wave.
We've got a new wrinkle buster, and this was something that was presented at our big meeting back in October, the American Society of Plastic Surgeons.
One of the latest procedures, the so-called vampire facelift.
What is this, a purse?
What is the red one thing?
Oh, this red glitter is fabulous. It's from Dr. Nassif of Beverly Hills. It's the vampire facelift. This is the latest, greatest thing to hit Beverly Hills.
Oh, I gotta see what that
Well, it's called the vampire facelift. Why? It's proving to keep many looking younger.
There is a procedure that can make you look years younger without the use of artificial fillers. It uses a patient's own blood. Alita Lopez has more on vampire facelifts.
Dr. Runnels saw beyond that and coined the designer procedure known as the vampire facelift. One of the world-leading plastic surgeons, Dr. Diamonds, is seeing a major boost in interest as soon as the photo of Kim tweeted out.
This week we have a lot of the procedures lined up, yes. We know plasma is very safe. It's your own blood being injected back in, basically, so it's 100% safe.
I think that initially people thought that it was kind of a gimmicky, sexy kind of procedure, but now it's caught on and really caught fire.
The vampire.
Vampire.
The vampire.
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 Vampire face.
Well, now there's a new procedure injecting people's blood components into their face.
Exactly right.
Tell us about this.
We've got a new wrinkle buster, and this was something that was presented at our big meeting back in October, the American Society of Plastic Surgeons. And what you do is exactly what you said, Travis. You draw the patient's own blood, you spin it, you separate the solid components, fibrin and platelets, from the other components. You take the fibrin and platelets and you inject it into wrinkles in your face, typically nasolabial
kind
line.
of like a self-filler, right?
And it is, and why that is, if you remember in your physiology and wound healing that platelets and fibrin form a matrix, and the collagen grows around that matrix. The other thing is that these products actually incite a growth factor release. So these would be the areas typically where we would want to inject these fillers. It's a little different. It's different than collagen. It's different than hyaluronic acid. But actually, they're getting pretty good results with it.
Are you using it yet?
I have not tried this yet. I mean,
Jim?
Give it a shot.
You don't
Right
mean
here.
personally on my face. No, not yet.
I was just trying to get a sense for how common this is across
But it's
the
similar.
country
When
right
we
now.
take fat, we spin it to separate it,
Now,
make
how
sure.
long does it last? Does it get a reaction, or does it actually last?
Well, you get about a year. So again, it's not
But
permanent.
those other fillers aren't permanent either, right?
No, right.
Well, and it may be a good thing it's not permanent because what if you don't like it?
So, same deal that you want to inject these intradermally, and what they're doing, that they will stimulate a growth of your own collagen. That's the idea, creating a matrix. Good stuff, interesting idea out of Manhattan Ioneer, my old stomping
I think
grounds.
that this type of therapy is going to become more and more common for a whole host of problems because you're using your own components
tissue.
to
You're not using synthesized manufactured products. Let's take a look and see how this works. These were done by Dr. Sclafani. He was nice enough to share these with us, but you can see the improvement, the filling of the nasolabial lines, corner of mouth.
Wow.
Early results. The great thing is, all natural. It's all you, baby.
Don't do it at home.
No.
I don't want people pulling their blood.
Don't do it in your garage.
No. There's definitely an art to all of these fillers and things, right?
Yes.
No. We said Kelty Colleen.
Here we go. It doesn't hurt. That was my first vial. I felt it. First the fangs, the needle, and then fast, arm up, so I don't faint. Secretly, I didn't want to tell the doctor because I wanted to act like I was really courageous, but I almost passed out for sure.
You okay now? You want to tilt you back a bit?
No, I'm
It
good.
does help.
I'm good.
Okay.
Dr. Ackerman of Newport Beach spins my blood to make the vampire serum. In MedSpeak, it's platelet-rich plasma.
PRP is a wonderful thing. It's been around for a bit, been used in various indications. Now we use it to make people look more beautiful.
The blood is coming. Kim's always colorful, but the blood is actually clear for the true vampire facelift.
Now in your particular case, we're treating very small area, little hollowness right through there.
Okay.
So you don't need that much. Same thing on this side. You ready?
Yep.
Just for a second.
One drop, one injection, and an almost instant lift. Do I have fangs now? So I know what you guys were thinking. Did it hurt? And to be honest, little pinpricks. It was doable.
Actually, I was thinking, what about steam and moisturizer? What happened to the good old days?
No, that had to hurt. Come on, Kelty. Great stuff. And next time we find something insane to do, we will send you again.
Well, for people experiencing hair loss, there is a new treatment on the market. It is less invasive than hair transplant procedures and could someday become the gold standard. Eyewitness News anchor Ilona Carson takes a closer look at stem cell therapy.
The idea that this procedure could spark new hair growth has breathed new life into the race to clone hair, and that may be just the beginning.
Arlene Johnson has been losing hair for years now, and she's hoping to turn back the clock.
It was taking me like 20-30 minutes to comb my hair and with products to make it look like I had more hair, and that is aggravating.
Her weapon of choice, what could be the future of cosmetic treatments, stem cell therapy.
The vials that we're using are a combination of the plasma and the A cell.
Hair loss specialist Dr. Daniel McGrath is hoping to jumpstart the stem cells in Arlene's hair follicles.
Typically with female patients that have female pattern hair loss, thinning that they can't do anything about, and they get some thickening and regeneration of their hair. That's huge.
Here's how it works. A small amount of the patient's blood is taken, and the platelet-rich plasma is separated out. That is mixed with a wound-healing powder called A-Cell and injected back into the scalp. Arlene's head has been numbed, so she doesn't feel a thing. Finally, the doctor uses some massage and small needles to create tiny wounds, which help trigger a healing response.
What sort of results have you been seeing?
The results we've seen thus far, not only in my practice, but in colleagues that I'm close with across the country, has been better than 80% regrowth of hair or regeneration of hair across the board with our patients.
Check out these before and after pictures. This sort of therapy is being tested for a host of cosmetic uses, from plumping lips to firming sagging skin, even breast enhancement. As for Arlene,
I don't want to look 60 or 50 or 40. I just want to look as good as I can for my age.
So the big question, how much does this cost? About $3,500 for a treatment, but Arlene says it'll be money well spent if it works. We'll check back in about 6 months to see her results. Alona Carson, 13 Eyewitness News.
The saying is, you're as old as you feel. Mary Mahaffey says she feels a lot better than she looks.
I feel very young on the inside and want my outside to reflect how I feel on the inside.
But parts of her face tell a different story.
Lines and under my eyes
are bringing her down. So she's ready to improve her look with an increasing popular facial procedure that has a creepy name. It's called a vampire facelift.
I am Dracula.
Dr. Charles Runnels is not Dracula, but the creator of this new type of procedure. He uses common facial fillers like Juvederm, mixing it with part of the patient's own blood.
Them under the skin where we can create a more refined shape.
Here's how it works. A nurse draws blood from Mary's arm and puts it into a centrifuge where it separates the plasma from the rest of the blood. Dr. Runnell injects her face with the fillers and then adds the platelets, which help give the fillers a boost. There's no major surgery, no recovery process, and it's a whole lot cheaper than a facelift, about $900 to $1,500, and should last a year to 18 months.
It's a millimeter here or there, and then the overall effect is a younger looking woman.
Mary got about a dozen injections and one tiny little bruise on her cheek, but 5 minutes later, she was allowed to put on makeup. Here's Mary before, and here she is after. You can see her cheeks are fuller and there are fewer wrinkles near her mouth.
These lines that are gone basically, my cheeks are plumper, my mouth looks younger. It's an overall much younger glow and I'm thrilled with it.